York State has been in a state-declared staffing disaster emergency for over a year now, and we lost thousands of people because of that. There are nurses right now that still can't sleep at night, that still see those horrible images night after night in their head. It is not right. It is not right what we're doing to the patients that need care. People are suffering because we have not addressed this issue. It is time for this hospital, who has money, we all know that, to come to the table and settle this contract today.
I'm outside Mount Sinai, one of two major New York City hospitals that's seen walkouts of over 7,000 nurses after contract negotiations with the hospital broke down. Negotiations broke down last night as the hospitals refused to meet the demands of the nurses for more staffing. The nurses say they face a staffing crisis where nurses are expected to take care of up to 20 patients at a time. The hospitals are accusing the nurses of jeopardizing patient care by going on strike, but the nurses are saying that it's the hospitals that are jeopardizing the patients by failing to staff their hospitals. Mount Sinai is one of the largest hospital systems in the country. With 8 different hospital campuses around the city, it takes in hundreds of thousands of patients every year. While Mount Sinai prides itself on the services it provides, it's clear that these services come at a cost: the well-being of its nurses. As their contract neared its end, nearly 99% of private sector nurses in the New York State Nurses Association voted to go on strike in the event that negotiations for a new contract broke down. The union reached contract agreements with 6 of 8 hospitals, but Mount Sinai in Harlem and Montefiore in the Bronx refused to give in to the nurses' primary demand for more staffing, triggering a walkout of over 7,000 nurses at these 2 locations. We spoke to nurses on the picket line to get a better picture of the staffing crisis in New York City hospitals.
Our nurses are taking much more than their recommended ratio, which is usually 2 to 1 for really acute babies, and sometimes they're taking up to 4 to 5, and that's really just unsafe for them and for their babies and for their families. It makes it really hard for us to do a really good job taking care of them, and as nurse practitioners, we're taking care of the neonatal ICU patients, we're taking care of deliveries for high-risk pregnancies, and we're covering well baby nurseries overnight, and it's just not, we're just not able to do a good job of taking care of all of those patients.
I mean, just imagine, having one nurse to 6 to 8 patients and having to think of all the needs that they could have various needs, and sometimes we want to be able to just feed our patients or give them a cup of water, even the simple things, and sometimes it's hard to even do that. I've heard ranging from the ED taking care of 15 to 20 patients for every single nurse, and I understand patients coming into the ED can range from like a simple cold to someone having a heart attack.
Despite clear indications from their nurses that staffing is inadequate, the hospitals are blaming the nurses for jeopardizing patient care by going on strike. Here's how Pat Kane, executive director of the New York State Nurses Association, responded.
This is nothing that any nurse takes lightly. It takes a hell of a lot to push the nurses to this point where they are out on the street. They would much rather be in there taking care of their patients. But the point is, they want to be able to take care of their patients safely. There are days and there are times when these nurses feel like they are doing more harm than good. And they can't live with that. This creates a situation, we call it moral injury. A lot of folks have said, oh, the nurses are mad, the nurses are upset. They're not mad and upset. They've been traumatized, and their heart, they have moral injury that they aren't able to take care of the patients and fulfill their professional obligation.
Instead of hiring more staff, Mount Sinai has resorted to paying travel nurses up to double what nurses at Mount Sinai make in an attempt to break the strike, seemingly contradicting the claim that they can't afford more staff. Despite this, even travel nurses from around the city joined the picket in support of Mount Sinai's nurses.
One of the major sort of aspects of this fight is that they're bringing in travel nurses to essentially fill the spots of the nurses. Why aren't you taking the job? Why are you out here?
Because I'm not a scab, but this is not how it should be. Right now, we should all be striking.
During the pandemic, Mount Sinai joined the chorus of hospitals, pharmaceutical companies, and politicians praising healthcare workers as heroes. 3 years later, their nurses have been forced to take the streets just to get Mount Sinai to listen to them. Pandemic or not, Nurses have always been heroes, and no amount of kind words is a replacement for a contract and basic human dignity.
And that's why we know there is no nursing shortage,
That's right.
just a shortage of jobs that we nurses want to work in.
Woo!